Okay, thank you. Hi, my name is Saskia Hollenberg, and I would like to thank Nicole Gaucheri from the Bath County Department of Agriculture and our wonderful Family Consumer Science agent here in Bath County for the opportunity to introduce you again a series for the Medicare scholars. And this subject for this month is going to be Medicare and women's health, a subject dear to my heart. And I apologize to the guys listening. So this is going to be more for us ladies here. I just wanted to also let you guys know that we are not going, we're not going into any kind of Medicare minutes in November and December. November, it will be right before Thanksgiving, and I know we're all going to be busy preparing for family meals. And in December, it's going to be right between the holidays. So we figured October would be here, our final set for this year. I'm an independent broker in the state of Kentucky, but I do have active licenses in multiple other states like Ohio, Tennessee, North Carolina, Idaho, Virginia, Michigan, Florida, West Virginia. This is important because I noticed a lot of my clients might be in other states visiting or also moving to other states, so I'm able to help there too. Or there's family in other states. I love to help people. This time of the year, obviously, it is all about Medicare, and I know you guys are getting hammered with phone calls and with mail and cards and endless advertisement on TV. And it is always good to work with a local agent because they normally know the market really very well. They know what is going on with the networks, etc. Most of you guys know me probably here. I live here in Bath County in this lovely area called P-Sticks. And originally I'm from Germany, Bavaria, mountain area. And we have 2 horses, 3 rescue dogs, a ton of chickens. I love to can. So here are just a couple impressions. Little personal note, I was able to visit for a few days in Germany with my 90-year-old dad. This is a picture here. And yes, he is 90 years old. This one here is the newest rescue. And here's my brother and his wife. So we had a nice day out. A couple comments from clients here. They have been happy with my services. But back to the subject, Medicare and women's health. So Medicare provides actually a health and financial safety net for practical all older Americans and for many Americans who are disabled and under the age of 65. Because women have a longer life expectancy than men have, more than half of the people covered under the Medicare program are women. And that's regardless of age, access to preventative care, routine checkups, screenings, exams. They're so vital for all of us and for all our well-beings. Here is a little chart. I think this might be interesting for you. As of 2019, women literally made up about 56% of all Medicare beneficiaries. Medicare covers many specific designed programs to help detect and treat conditions that are very specific to us women. One is the Women Examine, bone mass measurements, mammograms, breast cancer recovery, and other conditions and treatments are available. As of 2011, many of these services now are covered under 100% due to the benefit enhancement of the Affordable Care Act. When I'm saying these things, always remember there's always exceptions to the rules, and I will definitely address a couple in my presentation today. So the Woman Examine covers, it is part of the Medicare Part B. That is a clinical breast exam, pap tests, pelvic exam. It can be performed by your primary care physician or separately by your gynecologist. It is covered every 24 months. And Part B also covers the HPV test as part of the pap test. Now that is only covered every 5 years between the ages 30 and 65. If you are considered as high risk for cervical and vaginal cancer, or if you are of childbearing age and had abnormal pap tests in the last 36 months, Medicare covers these screenings tests once every 12 months. What makes you high risk? Personal health history, the history of sexually transmitted diseases, and fewer than 3 negative pap tests in the last 7 years. We have, you will not pay anything for the following tests if your doctor or other qualifying health care providers accepting Medicare assignments, which means they're accepting your Medicare red, white, and blue card. That is the lab pap test, the lab HPV test with the pap test with specimen collection, and the pelvic and breast exams. Bone mass measurements, big subject. I see this in my office quite a bit. That test is covered by Part B every 24 months if you meet one or more of these conditions. You are a woman whose doctor determines your estrogen deficiency and you are at risk for osteoporosis. Your x-rays show possible osteoporosis, osteopenia, or vertebral fractures. You're taking prednisone or steroid type medications or are planning to begin treatments with these medications. You're beginning to monitor to see if your osteoporosis drugs therapy is working. So these things are important. You know, there has to be a certain preset for these bone measurement tests. You will not pay anything for these tests if the doctor or the qualifying healthcare provider, again, accepts Medicare, which means it's called assignment. Mammograms. Part B again covers mammograms. Part B covers everything what is pretty much going under the outpatient groups, doctor visits, MRI, CAT scans, etc. This is why all this falls under Part B like a boy. One baseline mammogram if you're a woman between 35 and 39. Screening mammograms once every 12 months if you are age 40 or older. And then the diagnostic mammograms more frequently once a year if medical necessary. Now, here it is where I see a lot of questions in my office. That is when my clients are coming back at me and saying, I don't understand. Why am I going to get charged? So there's pretty much the two different scenarios. One is you don't pay anything for a screening test if your doctor, qualifying healthcare provider accepts the assignment. And if it's a preventative, so it's just the checkup. Now, if it's a diagnostic mammogram, so let's just say you went there, they saw something and you have to go back in, then it is called diagnostic mammogram. Then it will be 20% off the Medicare approved amount for the diagnostic mammogram. And the Part B deductibles applies. Now, I'm saying all this is all for somebody who is on original Medicare and does not have a Medicare Advantage plan or a supplement. If you do have a Medicare Advantage plan, it is a different scenario there. But again, keep in mind, you have these two scenarios, the preventative mammogram screening or the diagnostic ones. These are two different things. They will be treated too differently. Breast reconstruction, this is Part B again, covers external breast prosthesis, including post-surgical bra after a mastectomy if it takes place in an outpatient setting. Part A, that is the hospital part of your Medicare red, white, and blue card, covers the surgical implanted breast prosthesis after mastectomy if the surgery takes place in an inpatient setting. So this is important for you to know. You need to make sure you qualify these things with your doctor. You need to ask questions. And I know normally these are, everybody is in shock when these diagnoses are coming and nobody is thinking about asking all these questions. You need to be get help, get somebody else with you, take somebody else with you, share the video here so that people know that is what we need to look forward to. So you pay the Part A deductible, again, if you're on original Medicare, if it's done in the inpatient setting, or 20% if Medicare for Medicare approved cost for Part B, or the Part B deductible if it's done in an outpatient setting. So there are other services covered, and that is, for example, testing for HIV or other sexually transmitted diseases, treatment for pelvic and vaginal infections, treatment for abnormal vaginal bleedings, contraception counseling, menstrual pain, irregularities, menopausal management, which is important specifically for us a little bit older. These are the main things that Medicare is actually helping you with. If you do have questions, please feel free to give me a call. I can help in a lot of scenarios. Over the years, there's a lot of experience here. Give me a call and we'll see what I can help you with. I appreciate it, and I hope you have sorry about that. I hope you have a wonderful rest of the day, and I am seeing you next year. Have a wonderful, happy Thanksgiving and a blessed Christmas and New Year.